Good afternoon. Welcome back from lunch. We're glad you all could be here for this next program presentation. And Pedro Naranjo is our speaker, and he will be talking about wound healing, pain relief, digestive aids, blood and circulatory health, and calming stress and relief. So I hope you enjoy this program. It looks like to be a great program. Thank you, Pedro.
I appreciate it. Well, hello. Now, brother, I know they put you out on timeout, but you can come forward, That's all right. I don't bite. But if you want to stay there, it's up to you. I like small crowds because it's the best way to learn. We can get to interact, and we're going to have a Q&A. So I'll give you a little bit of a background on how we'll do this. I'm covering an emergency kit. I'm not going to cover the things that most people already know, like how to use charcoal and some of these other things that are very prominent. But I'm going to cover some of the things that most people don't know that they have access to that is very helpful and that they can put as part of their emergency kit. And afterwards, we're going to have a Q&A section so that if you have any questions about what I describe or any of the other natural remedies areas, we can then go ahead and interact that way. All right, let's get started. So this is a little bit about myself. My name is Pedro Naranjo. I am a firm believer in God's Word and a follower of Jesus. I'll let you know that because as I share with you clinical data, I will also share with you the promises of God that I believe are so healing. I practiced the health message for over 23 years. I'm also a solutions architect with IBM product. On the area of health, I am certified from Dr. Seo's Wellness Institute as a health coach, 3 specialties there. I'm also a member of the American College Lifestyle of Medicine, and I went on to do my studies in American College of Healthcare Sciences, doing my Master Herbalist. More important than all those things, I have been blessed with a beautiful wife and children, and this we use as a family as a opportunity for us to share the wonderful power that God has for each one of us. I'm going to be sharing a lot of clinical data with you. As you saw those categories, it is going to be more than you can possibly write down in the speed that I'm going to go through. So this will take you to your email, and it already is pre-configured so that you can just simply say, send me the information, and you can fill in the blank of what you're interested so that you can look up the clinical data and everything that is there. I will show you that with every part of the medical kit that we'll review, we will also look at the clinical evidence. The reason for that is because when you're talking to your physician, when you're talking to your doctor, he doesn't care about anecdotal data, meaning data that comes from you and I in our day-to-day lives. He wants to see clinical data and evidence so that he can compare that to the other research that he has. That takes us to our first category, and that is antiseptic and wound healing. All right, so what would you use that for? I kind of added this because sometimes I say the words like antiseptic, wound healing, and I imagine in my head immediately these things. But then I realized that not everybody will make that connection. So when I say antiseptic and wound healing, it really means in practical terms these actions that you can use with these herbs. Now there is a host of herbs that we can look at, but we're going to focus in one that you can put in your emergency kit that will be a real blessing, and that is aloe vera. Now, aloe vera has been a plant that has been studied for many, many years, and it is a wonderful, wonderful plant. Now, when it comes to burns, it is one of the key plants that you want to keep around. For instance, in this clinical study, it was a patient randomized clinical study that used aloe vera, and they found that they would heal 30 to 50% faster when using aloe vera than other methods. Patients also reported quicker pain relief, and that is very, very effective or very, very important, noticing that it's not only better than the drug treatment that we normally will get in the hospital settings, but it's also cheaper and effective alternative. And these conclusions are coming from the medical research, not from a person that has a personal, or let's say a preset bias to natural remedies, for instance, but rather from the observation of the research, and that's why it makes it so significant. It also enhances skin regeneration. So as you can imagine, whenever you have a wound, whenever you have a burn, you want that skin to regenerate nicely, to be moist, so that it could actually allow that skin to heal properly. So in these studies, it showed that aloe vera gel speed up wound contraction, that is the shrinking of the wound, and it also speed up the cell formation by 20 to 25%. It was treated treating wounds, it will heal faster, and the new tissue form with better organized and less hypertrophic. And what this means is when you look at the wound, it looks like a clean seam, not bulging at the edges or all over the place. It looks very, very well done. And so it's antibacterial, antifungal. It's a real blessing when it comes to skincare. As I mentioned before, it is antibacterial and antioxidant. This is very important because remember, our bodies produce 10,000 free radicals per day. Each one of those free radicals has the capability to turn cancerous. What is cancer? It's the uncontrolled proliferation of cells that have been damaged. And the free radicals are not balanced cells. So the antioxidant is a cell that has extra that it could share. And when the free radical, which is unbalanced, comes and says, give me that neutron or that electron, whichever it needs, it will then share and allow the free radical to be balanced and to be able to not create more problems to other cells. That's why antioxidants are so important. Anyway, it showed reduction of bacteria up to 60%. Again, gram-positive and gram-negative. What does this mean, Pedro? What is this negative, positive craziness? It's very simple. When you look at bacteria, which is much bigger than a virus, just to give you an order of magnitude, a virus would be about 1,000 times smaller than a bacteria. When you look at it, there are two major categories that we have. It's what is called gram-positive and gram-negative. And that means that there are some antibiotics that will only be effective, for instance, against gram-positive. There are others that will be effective only against gram-negative. When you have a broad spectrum antibiotic, that means it is able to deal with both. And so we find that aloe vera has this antibacterial properties that is able to deal with both, which is very good. And is able to reduce oxidative stress by 40 to 50%, which is an absolute blessing. So here are the references. If you notice, let me just take you back so you can see. At the very bottom, you see a little number in squares. That little number equates to the reference here. So again, you can take a quick picture if you like, or I can send you a copy as I show you in the QR code later on. But it will be a real blessing for you to kind of go through these clinical studies and see what the world of science have been finding about aloe vera. Okay, what are the practical ways to deal with this? We have like 5 other categories and my time is running. So I'm not going to be able to sit here and explain each one. But please take a picture. And basically, the aloe vera, you can take it internally and externally. This is to be taken externally, okay, this particular application. And so the easiest way is to basically get the aloe vera, if you have it fresh, get the aloe vera leaf, make sure that you take all of the green part away. That green part could be toxic if you take it internal. And then just leave the clear gel. You can basically make a cream or a poultice out of it and apply it directly onto the wound after you have cleansed it. So this is a little formula here, how to mix it with raw honey, which makes it even better. And it has some amazing properties of how you can take care of this. So if you had a situation where you needed some wound care, you can just put it right on, and it really helps to be able to take care of that for you. All right, let's move on now to anti-inflammatory and pain relief. And I tell you, I've dealt with people who are in pain. I have made myself in pain. And being in pain is no joke. It's you at that point, you want something quick, you want something that works. There's not the time to be doing experiments. You really want something that will be a blessing. And curcumin, which is the extract from turmeric, is one of those that are a real blessing. Curcumin is prolific here in the United States. You can find it just about anywhere. And it could help when we talk about anti-inflammatory. It can help in any one of these things. And inflammation usually comes later on associated with pain. So that's why I put those two together, and they are a real blessing. Okay, well, this one is in the wrong language. So I'm going to translate for you. This is in Spanish, and I think it sneaked in here from one of my talks that we just did in Guatemala. But anyway, in this particular study, they were looking at osteoporosis, I think it was, in the knee. And this had a number of participants, about 1,258 of them, in which they found that they were able to alleviate the pain much faster than just the regular treatment. And that's what you see there in the middle about the statistical significance of what they have in there. It also found that it had less side effects than the regular treatment that was given to the people there, and that was a real blessing. All right, this is back in English, so this is good. This is now after the operation, the inflammation that normally follows. In this particular study, they found that taking 400 milligrams of curcumin gave them about 84% reduction of total inflammation. This is quite wonderful, notating that all of that was without the associated gastrointestinal side effects. Meaning, if you were to take the drug, you could do something similar to that, but it will come with all of this other side effects. And that's what we find in its majority when we look at drugs, and as a general, they might alleviate XYZ, but it almost seems like they start something else somewhere else. And that's obviously not desirable. We want something that works, that our bodies can work with, and curcumin seems to be doing very well when it comes to that in the clinical studies. These are the two studies that I mentioned before, and you're happy to take a picture of that, or I can send you a copy as we are able to move forward. So how do we use it? Well, curcumin can be used in several ways. This is what is called the golden paste, and this is something that you can prepare and then be able to use it later on. You can use it internally, and actually this paste you might even be able to apply externally if you want to, but this in particular is to be used internal. So if you don't mind, you can take a picture. It has the details of how you'll be able to do it, and it is a real blessing. The brand, I think, is called Stop Pain Now, curcumin Stop Pain Now. I think one bottle, it's like $100 some. So this is much more affordable, and it allows you to do it at home. All right, let's look at this one. This is a paste that you can also use. This is also to be used internal, and it can help some of that absorption, especially with the BioPerine part of it. And we also have it here, and this is now more of the external application. This is when we're making a poultice, so that you can have that piece be part of it, and it's such a blessing when you're able to put it together. These things are good to have somewhere written down or a copy of the slides, so that when you're ready to make it, you can make it ahead, and is such a blessing. All right, so let's see if we can move on. Jumping onto now papaya seeds, and this is in digestive aids and anti-parasitic. Now, then we have a lady, she's an RN, and she's doing a lecture at the bottom when she's talking about parasites. And I'll tell you, if there was one class that traumatized me when I was doing my clinical studies, it was the one about parasites. It really opened my eyes to a lot of things that I did not know. And some of them travel through our bodies. Some of them come out and say hi, and then they go back in. It's quite interesting. I don't want to get into the details because you just had lunch. But my point is, this is real. And not only is it real, but it could cause a lot of different issues in one's body. As a matter of fact, it's one of those things that a lot of times the doctor will miss, because we're not I guess, geared it to think about these things that these parasites can do, but they are real and very, very important for us to know how to deal with them. So, when it talks about bloating, gas, and digestion, and of course, the different type of parasites that we have there, and believe me, there are several varieties, as well as helping the gut bacteria to grow and have good production. This is where we have the papaya seeds. Now, this is quite amazing because not only do we have it here available in the United States, but it's also available around the world very affordably. And I will show you some of the studies now. It has an anti-parasitic effect. In Nigeria, they found that when they consume it in this particular trial, 76% of those that consume their particular solution were clear of the stools after 7 days. And that is only, that's very effective compared to only a 60% of the control group. That is the group that didn't have anything else on it, that placebo effect. So it really helps those parasites to move on and not be there without paying rent, so to speak. It was also done in a broad study. It was found that if you ground 10 grams of papaya seeds into the food supply, and this was done in a large scale for the school, it had a significant reduction of those parasites in the load for children. Why is it important? Because not only can you do it here in the States, but you can also share with those that are abroad. And there is such an amazing thing that helps cleanse the body. Oh, I don't have parasites, Pedro. I have a very clean GI tract. And I heard that quite often. I said, well, just try it. Just try it for 2 weeks. And you'll be surprised who you had in there not paying rent. And so you want them out. All right? You will see them in your stool. Not quite floating, but some of them, yes, you will notice them. Yes.
You don't have to pull your stools off.
No, it'll be very visible. And more important than that, you will begin to feel the healing effect of not having them there. I tell people, having parasites in your GI is like eating and somebody else eating the food for you. You're not really consuming it, they are. And then they produce byproduct that creates inflammation. And so you have celiac disease, you have leaky gut, you have all these other things. And they say, oh, it's just I'm allergic to food. And what's really going on is that you got some creatures down there taking care of the food. I don't want to... Anyway, this is one of those classes that, like I said, that has really traumatized me. But some of them will travel through your body to your lungs. Some of them will come out in certain orifices of the body at night and say hello to the outside, and then they will go right back in. And that's what creates itchiness in those areas of the body. Okay? So if you have heard of people that have itchiness around the anus and such, and sometimes even in the ears, that could be parasites actually traveling through. And so I'm just telling you, there's a whole world out there to explore. Learn more about them. Make sure you don't do it at your lunch hour, for if not, it will be difficult for you to have lunch. But anyway, these are real, and this very simple remedy that I'm going to show you can actually help you do it. So, how do you do it, Pedro? Well, this is the way that they do it, per the study. And it takes 2 weeks, overall in general. Even in 7 days, you can do a majority of the cleanse, but I normally ask for people to do it for about 10 to 14 days. That's more or less the minimum. Okay? So there's a very simple way of doing it in which you can do a cleanse. I normally recommend a cleanse once a year. That would be the best kind of cadence for this.
And eating them raw, like when you just scoop some seeds up, that's not going to do it?
It's a good question. We're going to have Q&A at the end. Hold that question, and we'll get into the practicals. I think that's a good question. What about raw? But we'll get into that one. How about blood and circulatory health? Okay, when I mean blood and circulatory health, I mean these things that you see here. Health and stamina. How many of us would like to have more of that? For sure. Some people are dealing with high blood pressure, cholesterol, varicose veins, poor circulation. Okay, so this helps with all of these areas. And the herb that we're going to talk about is hibiscus, an amazing herb. And just so you know, the part that is medicinal, that is really used, is that capsule. You see a little capsule that encapsulates the flower? It's not really the petals, but it's that capsule. Only relevant if you're getting it, dry. But anyway, so in the systematic review and a metadata analysis, so when it says systematic review, that means it's looking at several control studies that has been done of more than 1,000 participants. They found that by taking hibiscus, it will lower their systolic. So blood pressure, you have systolic and diastolic, okay? That's when the heart is pumping, systolic, versus when the heart is at rest, diastolic, okay? And so you have those two blood pressures there. And so it found that in the systolic, it will lower, excuse me, by 6.67 mm's, and the diastolic by 4.35. Excuse me.
Could you go back to the one before it just first?
Sure, absolutely. There you go. And by the way, at the end, I'm going to have the QR code again, where you can get the copy of the slides if you want to. So, because the clinical, we have to go through far more, and so I want to go through and make sure we get to the end. All right, so what did it do? It lowered the blood pressure. What were they doing? They were taking hibiscus. And this is for people that have hypertension, mild to moderate hypertension. And so these are people that now have been clinically shown that they needed to do something, because if not, it put them at higher risk of a heart attack or a stroke. And so they started taking hibiscus, and it lowered their systolic and diastolic pressure. What an amazing blessing. It also showed in a randomized control clinical trial that it had a even greater significance of blood pressure reduction by 7.43 mm's and the diastolic by 6.70 mm's. What does that mean, Pedro? It means that your blood pressure can go even outside of the range of hypertension into the lower range. Now, you gotta take this to a grain of salt, because if you have high blood pressure, you ought to be asking yourself, why do I have high blood pressure? Right? So we're going to get to that when we get into how to use it. All right, another interventional study, again, showed the same thing. This was done in Iraq, and it showed that it had tremendous results in the intervention, so much so that in the group that was being tested, they actually came out of the hypertension group into the normalized group by taking hibiscus. So that was such an immense blessing to these people. These are the clinical data where you can go and read, and more important than that, even share with your physician as you're discussing these options. Because unfortunately, if you talk about high blood pressure with your doctor, he might not be aware of hibiscus. And if you tell him about hibiscus, he might think you're just crazy. But if you show him the clinical data for hibiscus, well, now you got some backing for him to read. And he can see that this is not just you being crazy, but there's actual clinical data behind it. This is why this is important, so that both patient and doctor could have a better collaboration phase and be able to do it better. So how do I do it, Pedro? Well, there's several ways. You can do an infusion, not to be confused with a tea. A tea and an infusion are not the same things. An infusion is much more concentrated. So therefore, you must follow the steps that are there, because the ratio of concentration is much, much higher than for a tea. You can also take it in capsules. I found that one of the greatest challenges that we have in healthcare overall, whether it's allopathic or naturopathic, is compliance. You can talk to the individual, you can tell them this is good for you, but that they go do it at home is a totally different story. And so a lot of people find it, well, and I don't have time to do the infusion, but they can use the capsules. And lo and behold, they work well. You need to take about 500 milligrams. And so that is a real blessing for you in that schedule as it says there. All right? So, with that in mind, we'll move on to one of our almost last categories, which is calming and stress relief. I tell you, we live in a world today that is going 1,000 miles per hour. It seems like you wake up in the morning and night comes and it's like the day just blew by you. And so whether it's the stress at home or whether it's the stress at work or a combination thereof, God wants to give us peace and rest. And He has created some not only amazing, effective natural remedies, but also beautiful. Look at that beautiful flower called the passion flower. It has some amazing effects on the system when it comes to dealing with stress. All right, let's look at that, what that is. Your camera did not do it on time. Okay. That's all right. Very good. Okay. So there is a generalized anxiety disorder. Before I describe this, I want to make a difference here. There is a difference between anxiety and depression. What is the difference between the two? Do you guys know? Anybody? What is the difference between anxiety and depression?
I would guess for one thing,
Okay.
depression is more chronic and anxiety is more acute.
Interesting. That's an interesting way to look at it. Clinologically speaking, both of them could be chronic or mild or acute. So it's not quite that, but what is the difference? Well, the difference is anxiety is focused in the future. It's worry of something that is not yet here. It has not happened yet, but there are possibilities that could happen, whether it's imaginary or not. Okay? It's focused in the future. What's going to happen if I can't pay the rent? What's going to happen with my kids tomorrow? What's going to be the outcome of X, Y, Z? Whatever. That's anxiety. Depression is mostly focused in things that have happened in the past that now affect you at present. It's something that has been in the past you can't quite shake out. Well, whether it's anxiety focused in the future or depression based yourself on the past, neither of them let you live the present time. For you see, the future is not yet yours. Tomorrow has not yet come. And yesterday is already gone. Right? Neither of them let you live today. And so, very important that we understand that so that when we talk about these herbs, we understand that there is a concept behind them, which is very important. That is, God wants to give you rest today and live one day at a time. Okay, this is a very important principle. So, when we talk about generalized anxiety disorder, or GAD, in this particular double-blind study, they found that it reduced anxiety symptoms with no significant difference in efficacy in the two groups. However, the group that took the drug experienced more job impediments. So they were testing the drug versus the natural. And they found that they both work well, but the drug had far more side effects than those that were in the natural. Are you following me? And so this is why it's important that you and I know and make educated choices. Because, especially when it comes to SSRIs, which is serotonin reuptake inhibitors, those are one of the most disruptors and potent killers that we have in our pharmaceutical industry today. Please make your research very certain before you take any one of those, because it literally changes your mind. I'm talking about people who are professionals in the medical industry, nurses that had to be hospitalized in psychiatric units because they started seeing things. There's a long history of the psychological byproduct of SSRIs, which is one of the most prescribed drugs for anxiety. Please do your research and try the natural. It is quite destructive when it comes to the other side. Anyway, in this clinical trial, they had good effects and good outcomes in that. Again, This is in preoperative anxiety. People who are, again, the operation is coming and they're nervous and they don't know what to do, they're going to do there. And so they try hibiscus, and it had significant effects in their reduction of anxiety without the sedation effects. Why is this important? Because when you're wanting to have the operation, you want to have cognitive ability for your body to function well. At the same time, they reduce that anxiety down. So this was able to do it so that the person was cognitive and is able to do the operation afterwards, of course, under anesthesia as they normally would. It helps in stress and sleep disorders. Well, you go to sleep and you worry. What's going to happen to the children? Can I pay the rent? What's going to happen to XYZ? Oh, does my husband love me? Why is he not home? Etc., etc. And the list just keeps on going on and on and on and on. And my examples are mostly from the female side, and maybe that's because of a lot of anxiety and stress that I see. I deal with female clients. Most of the men just want to not acknowledge it at all. But at least the ladies are coming forward and saying, we need some help. Anyway, the point is, this is an area that is very important. So they found that when they took the passion flower, it had a definitely effect on sleep and their stress level. And it was beneficial, but improving not only their stress, but also their sleep quality. All right, so here's the clinical data that I just described from that area. And now let's get into how do we use it. All right, so what I've done is I have broken it down by the individual situation. So if you have GAD, which is just anxiety or generalized anxiety versus you're dealing with stress and sleep disorders, these are the ways in which you can actually use it. Okay, and preoperative is just what they use in the clinical, but this could be just general anxiety as well. It's just that one is stronger than the other, and it just helps you to have a balance of that. Okay, as promised before, I know I've gone through a lot of data. If you take a look at that QR code, it will create an email for you automatically in your phone, in which you can then just describe what you like for me to send you, and I can send you a copy of the slides so that you can read the data, have the links, and be able to be informed, and more so, share with your physician so that both of you could learn and put this in practice. Remember, when you share these things with your physician, whether it's your PCP or otherwise, that's your primary care physician, you're not only benefiting the relationship between yourself and that physician, but now you have influenced that physician to be able to practice this with other people. So it could be a very beneficial situation. All right, great. Now it's your time for Q&A. So I know I cover a broad spectrum in this area, but I'm happy to go back and review any part of this. This is your time for Q&A. So I'll put the timer in. Time is yours. What questions might you have? Oh, yes. That's right. That's right. Yes, if you don't mind, so that it goes onto the recording. And if I left you speechless, oh, there's no, there are questions. Yes, sir.
Is this on? Is this on?
Yes.
As far as the papaya seeds,
Yes.
I mean, a friend of mine just told me he takes scoops of them, with a spoon out of the papaya and swallows them. Now, I don't know if that works or if it's as efficacious, but I'm wondering there'd be three things that would seem to be choices. One would be the whole seed. One would be to put it in a blender and give it some mastication first and then take the raw. Or the other would be to dry it and then take it.
That's an excellent question. So how do I do this? So if you take your papaya seeds, we have something called transit time. So what is transit time? Transit time means from the point of ingestion to the point that it exits your system, how many hours does it take? Now, what is the average transit time of a healthy individual?
4 hours.
Nope. Average transit time, that's from the time it goes in to the time it comes out.
You mean food, a meal in general?
Yeah. Yeah, general transit time is somewhere between 8 and 12 hours. Okay, that is from the time you ate the meal to the time the meal exits
I'm
your
thinking
system.
about waiting 4 hours between meals.
No,
It's,
that's a good
the
point.
other
Now,
meals
digestion.
is in your intestinal tract.
That's right. Now, digestion overall of a plant-based meal does take 4.5 hours. By the way, as a point of trivia, how many hours does it take for a meat-based meal? 72 hours.
Wow.
That means the chicken that you ate 3 days ago is still in your large intestine.
Does the digestion still 4.5 regardless?
No, not quite. What happens is you do have a movement from the stomach into the small intestine, but the problem is our acid in our stomach, hyaluronic acid, is not strong enough to dissolve the meat. Therefore, the meat has to putrefy in our gut to be able to be processed. That's why it takes 72 hours. And so, you know what happens when that putrefaction sets in? Inflammation is the result thereof. Anyway, so coming back to your question. So if you were to put the papaya seeds in and you had a plant-based meal, that process of digestion would not give enough time for the bacteria to break down all of the seeds. So what do we have to do? We have to dry them or blend them so that we can get to the inside matter of the seed. So in most of the studies, they already have it in powder form and they add it to the food. Okay? If you have it raw, the best is to blend it or dry them and then
And
pulverize
eat it
it.
and blend it and eat it by itself?
You can eat it like part of the smoothie. I would
sure,
say.
that's a good
Yeah,
idea.
that would be an easy way to do that. Now, normally, again, because we're here in the States and most of the time you can get them dry, it's easier to take a tablespoon of the dry, put it into your smoothie, and you're done. Now, if you do have the raw, that's fantastic. Just make sure that you blend it so you can get to the raw matter of it, because if not, most of the seeds would actually come out intact the other way. And so, not enough time to break it down. By the way, that's the same for psyllium, not for psyllium husk, for flaxseed. That's why flaxseed needs to be ground. There is a therapeutic treatment of whole flax seeds, but they need to be hydrated, which is a part that most people miss. And so they miss the benefit of that part when the seed is as a whole. And it has a different therapeutic effect as when you blend it. That's a different talk altogether.
And back to anxiety.
Yes, sir.
You know, as I contemplated my initial sort of impulsive reaction of what I thought the difference was,
Okay.
anxiety would almost seem to me to be the manifestation of worry, because there's almost a physical aspect and a mental aspect to it. And I would also say that Sister White said, because I'm sure in any synonym book, synonym for anxiety is worry, or vice versa. And Sister White said worry is blind and cannot see the future.
They cannot see. That's very true. That's very true. And that's a good point that you have. Now, this definition of anxiety and depression is the clinical definition of anxiety and depression. We know that God is very wise when He asked us to live one day at a time. This is something so profound, yet so simple. One day at a time. Tomorrow is not yet yours. Yesterday is already gone. All you have is one day at a time.
Amen.
And so when you keep that in mind and you learn to put these worries, these things in the in the hands of Jesus, then you'll be very blessed. Let me speak a little bit more about this anxiety thing, because it has a tremendous grip on our people. I met a lot of good Christian folks who say, you know, I don't watch that garbage anymore, talking about the movies and the entertainment of the world, but I do watch the news. And I said to them, you do? And they say, yeah, that's the reason why I have the TV at home. I watch the news. I said, Say, well, let me ask you something. When you finish watching the news, do you feel more calm and relaxed and hopeful? Or do you feel depressed and worried and oppressed? And they said, you know, more of the latter than the first. Because you see, the more you expose yourself to these negative things that you're listening to, the more that in your mind they will play. And so very important that you realize that the devil is very smart. And he sometimes keeps you, even on the news, going on something that is absolutely negative. And that's not what God wants us to do. He wants us to be focused on the positive. So, sometimes people say, did you know what happened in so-and-so? I said, no, I don't know. And so some other people might tell me about it. And, we're talking about it at work. And one of the other guys said to another friend, said, it almost seems like you live underneath a rock. And I said, the other gentleman's name was Mark. And I said, Mark, I'm right there with you. We live underneath the rock. But there are benefits of living underneath the rock, so to speak, because there's all this negative stuff that does not affect you. If you are Christians, where can you get news that are accurate yet positive? That's the Bible, my friends. Absolutely. And you know why? Because those news are the good news of Jesus' second coming. And so I don't advise my clients to expose themselves to negativism, whether it's through the news or social media or the entertainment of today. I advise them to expose themselves to positivism. Where do you find that? In God's Word and His promises. And so when you go to sleep, and as a Christian, if you are one, and if not, I encourage you to try, you put all your troubles in the hands of God, and you allow Him to take those burdens from you, then you can have peace. And then you can have passion flower infusion that could help you relax. To work with a serotonin that wants to kick in so your brain kind of shuts down and is able to go to sleep. Versus turning in your mind about all the things that are happening in the White House and the Pope and the Antichrist and all these things. Listen, you're not going to solve all those troubles by you thinking about it. You need to give them to the Lord. And that helps for you to have that peace and that calmness. All right, any other questions?
Well, Pedro, I would also say when they tell you you live under a rock, you could always tell them, well, you're close, I'm in the cleft of the rock.
There you go. I want to be in the cleft of the rock. Amen. I like that, brother. Thank you for sharing that. Yes.
I want to give a short testimony. When I lived in Spokane, I watched the news, and I was scared every day.
Is that right?
Now I'm in the country, but my question is, I agree with what you're saying.
Okay. Repeat that again, please.
About Spokane?
Yes. Yes.
Okay, when I lived in Spokane, I used to watch the news before I became a Christian, and every night I was scared. And then one time God showed me that, I guess I was exploring God at the time, but He showed me that that was not my actual life. I was bringing in things that weren't happening to me.
That's right.
So I was scared all the time.
That's right.
But anyway, now I live in the country. But I agree with what you're saying about watching the news, how it just produces anxiety.
Surely.
But at the same time, where is the balance? Because the things that are going on in the world that are fulfillment of prophecy,
Truly.
how do you learn those things and know those things if you don't watch news? So could you help me with
That's
that?
a very good question. Excellent question. I love that. How do we stay relative in a world that is ever changing if you're not watching the news? Others will tell you. Others will tell you.
You can count on it.
Others will tell you. It's that simple. You don't have to watch the negativism. It will come to you. It will come to you. You see, others will tell you, I don't watch the news. It's been 20 years that I don't watch the news. Actually, more than 20, 23 plus years that we don't watch news and all that stuff. And I yet know the major events that has happened in our history because others told me. They tell me at work. They tell me here and there. But let me tell you, when it comes to me, I don't know all the graphic details. I don't know all the other stuff. I get the summary from them. And you know what I offer them? Prayer. Now, I work in the world of IT as well. With the executive level of people. And some people there don't normally bring religion into work. But I am not afraid to tell them, you know what, I'm sorry, that's terrible news. We need to keep them in prayer. And they're like, wow, that's a fresh perspective. Because it's positive, right? Rather than just rolling over the negativism and just repeating how horrible it was, and then somebody else comes in with more, you can bring something positive. Let's pray for them. And don't be afraid to bring in a positive element to life. Because remember, God already told us the news. There is nothing new underneath the sun. As a matter of fact, we are told that the news today is a school of perversion, where we are teaching the new generation the wickedness of the world. Because by revealing all these crimes and how they were done, we teach others how to do the same. It's quite interesting. Do a research about it, and you will find God wants us to be exposed to the positive things of His Word. Stay with the negative out and stay with the positive that God has for you. Any other questions before we close? Okay, the lady here, and then back to lady here.
I was wondering about this passion flower or hibiscus as far as ministered for children.
That's a very good question. That's a very good question. So let's just take this particular example. Whenever you see this references, most references that are published in the clinical data is for an adult. Okay? So there are several formulas by which you can look at this. Now, children, it used to be that children were proportionate to their age in size and body. Nowadays, that's not the case. You can have a child that has the mass of an adult, okay, body size. And so you have to, the clinical way of doing it is looking at the body weight. And this, normally, an adult, what is an adult? It's 150 pounds. That's an adult. And so what you take, the approach that I take is more of a ratio. So 150 pounds in this case is equivalent to 400 milligrams per day. So if the child is 75 pounds, what will be the dose then? 200, right? It's half. It's a ratio. So 150 pounds is an adult. That's 400 milligrams per day. When it comes to a child, you begin to take a ratio to it by its body weight. Okay? Again, I say that carefully because you could have a 150-pound child of 10 years old today. Okay? And that's the same body weight as an adult. And so you have to take that into consideration. Now, passion flower, it's very well tolerated, generally speaking. And so make sure that it's okay, especially for that particular age. Now, there are certain things that are not okay by age alone. For instance, honey for an infant that is less than 1 year should not be administered. Not because honey has anything wrong, but the honey might have some of the spores from the flower. And that could set an allergic reaction in a very young, not yet fully developed immune system of the child. And so in order for a child to receive honey that is less than a year old, it had to be sterilized honey or clinically processed honey. And so it's best to not use it at that point. And that's completely by age. But outside of that, generally speaking, you go by the age of the weight of the individual and their age combination. Okay? Yes, ma'am.
Did you already address how to obtain these compounds?
Very good question. Yes, all of these are all of them are available in any natural store. Any natural store. I mean, if you don't find it there, go to Amazon. That's the easiest way for you to get them. Okay, you can get them in a dry form or you can get it in pills as well. If you get them in pills, get the one that has the least amount of ingredients and that is a vegetarian capsule rather than a bovine-based capsule or animal-based capsule or gel-based capsule. That would be the easiest way to find it. So you can find, there is in Spokane Natural Grocers. here in Hayden, you have several natural stores that have it. And so if you go there, you will find it in tea form, and you will find it also in a dry form powder. So it's very, very easy to find. And these are very easy to carry. When you're talking about your emergency kit, these are things that you can have so that if you find yourself, you can make a tiny small one that has a little nylon Ziploc with a couple of, enough doses for one whole treatment. And then you can share it with other people, if you're having that situation. Yes, ma'am. Okay.
Sorry.
That's okay.
I love the taste of hibiscus flower tea.
Yes.
Does it have enough benefits of its own, or do I
Good
need
question.
to get
Good question. So hibiscus, this is, I put this picture in because most people get confused of what part of hibiscus do you use. And the part that you use of the hibiscus is this part. This is the part that has the medicinal extract of it. When you get it to flower already, now there are some medicinal properties to it, but not as concentrated, because the part that has the most concentrated part is this area here that is in the bud. And so it's not as strong. It's more than for just kind of, high in vitamin C and such, that could be helpful. But if you get it from that fleshy part of the flower, especially as it's come on, of the dry hibiscus, it is amazing, okay, for especially high blood pressure. Now, I say a word of caution on this. If you have hypertension, and you're taking the drug for hypertension, and you start taking hibiscus, guess what's going to happen? You're going to have a hypotension episode, right? Why? Because you're having a compound effect. You're having the effect of the drug on top of what? The natural remedy. So, natural remedies, you need to be careful as you take them, because you can have a compound effect. The same for diabetes. Oh, Pedro, I want to try amla, which is one of the most studied herbs for diabetes. But I'm also taking my regular drug. Is that a good idea? And I tell them, no, that's a terrible idea, because you're going to have a hypoglycemic episode. Why? Because you're having a compound effect. So, just like when you're going to have surgery, what did it tell you? Do not eat garlic. Why? Because garlic will thin your blood, and it has an effect before you have the operation. So therefore, you must also take into account that just because it's natural doesn't mean you can mix it with a bunch of drugs and be okay. So, be advised. Yes, madam. That's okay. You got all the questions. All right.
Well, I'll let it go. But
Yeah, no problem.
if a person has chronically, it's just naturally low. I guess it's naturally low. I'm talking about me. My blood pressure is always low. So would that actually be dangerous for me?
Not quite. Let me just tell that for most plant-based individuals, their blood pressure will be low. You know why? Because their pipe is clean, and the heart just has to pump once, and it goes to all the extremities of the bodies. But what you have in the regular population is you have clogged arteries. So the regular blood pressure numbers that we have are from those who are already affected in their cardiovascular system. And so when I go take my blood pressure, they'll say, oh, you have low blood pressure. And I say, no, I'm plant-based. And that means that I will have normally lower blood pressure. However, if your blood pressure starts getting too low, talking in the 50s, 40s, even 60s, you have to be careful. Low blood pressure that is okay is regular in the 80s to 90s. 70s, I start to maybe pay attention what's going on there. You might have other things related to the heart, probably due to dehydration, which is the reason why we see sometimes those episodes of hypotension and then hypertension, because you're going through a cycle where the body is responding and trying to save you, basically, of going into a hypotension episode. Our time has been up. I really appreciate your attention. I will leave this up so that if you have any questions, feel free to send me a quick email. This will take you there. May God bless you. Where do you live? Newport, Washington.